In lieu of a traditional PowerPoint presentation, I thought I would show you my analysis for my strategic plan through the eyes of the operating room. In the operating room, we looked at a SWOT analysis to determine what our strategic goals were going to be. And when we looked at the strengths of this operating room, we have a departmental educator. We have an OR equipped to handle all service lines. We're trying to grow unique service lines, and we have low staff turnover. Some weaknesses of this operating room are that the staff are inexperienced and young. There's better pay in the area. We need to better utilize our coordinators to fix preference cards and repair equipment. And then we have an issue of trauma surgery versus community-based physicians. Some opportunities that we need to look at are to better utilize our large healthcare system to access ideas and not reinvent the wheel. We need to focus on updating our hospital and the equipment in the operating room. Some threats that we have in the area are surgery centers that offer better pay and no call. There are also hospitals that have better pay in the area. We have a need for a large capital investment, and we have to be concerned about younger staff who might leave. After doing a SWOT analysis, it was determined that the strategic goal would be to grow several service lines by 1.9% over the next year. In particular, we would grow a bariatric service line, an orthopedic trauma service line, and neurosurgery. When looking at who will be involved in the growth of the operating room, it starts at the top with the Chief Operating Officer. The Vice President of Procedural Services will lead the initiative. The Physician Relations Representative will work with the offices on how to schedule cases and on how to meet with the physicians. OR service line coordinators will coordinate with the physicians, their preference cards and operating room equipment needs, and any repairs that need to be done. Pre-admission testing will also work with the offices on how to get their patients ready for surgery to prevent delays on the day of surgery. Single-day surgery will focus on the patient the day of surgery. The recovery room will focus on the post-operative care, and the OR educator will work with all of the staff to make sure that they are educated on the procedures that we're going to be doing and help provide in-services. When we look at the timeline for this strategic growth initiative, it begins in 2017. We will focus on it on a monthly basis. We will review and have meetings to focus on the goals and to establish our timelines and to make sure that we're meeting those goals. This strategic initiative will take place at a 200-bed hospital with a Level 3 trauma certification. The hospital is currently seeking a Level 2 trauma certification. We have 13 operating rooms, 2 hybrid rooms, one of which you're seeing right now in this video, an open heart program, and a thriving robotics program. To begin this strategic initiative, a kickoff meeting will be held involving everybody involved in the project, including some of the stakeholders. We will communicate the goals that the executive team has set to grow our business by 1.9% over the year of 2017. We'll establish a priority list and we'll make assignments. The Vice President of Procedural Services will send out meeting minutes with those assignments. We will have follow-up meetings on a monthly basis to review the action plan to make sure that the assignments are being completed and to look at the volume to see if it's making a difference. We will revise the action plan as needed and meet more often if it is warranted in order to meet our goal in the year 2017. Why does a hospital want to grow surgical business? Surgical growth generates revenue and creates a larger patient base. This larger patient base brings patients back into the hospital for labs, x-rays, other procedures. At this point in time, I'd like to conclude the presentation and open it up for questions.
Exactly where does the hospital get the capital to begin a project like this?
Luckily, we work for a large corporation, and we have different avenues to generate money. When there's projects like these for service lines such as neurosurgery, and you're looking at purchasing microscopes that cost hundreds of thousands of dollars, we have a fund called an RCAP. We select that fund, we ask our company for the money, we have to show the need for it, We have to show them that we're gonna make money in the long run. Once we can show that we're gonna make money off of the service line, our company will generally give us the startup capital needed for a procedure.